All right, thank you so much, guys, for coming. It's our last lecture of the year, actually. We're going to do cranial nerves. There's 12 of them. They arise mostly from the brainstem, and 2 of them arise from the cerebrum, from the base of the cerebrum. We'll talk about their functions today. And I'm sure you remember when we did the skeletal system, we had to learn those little holes that were coming into and out of the skull. So today we're going to make use of those because most of the cranial nerves come out through those holes, okay? Today I'll need you to know the name of that cranial nerve and then the Roman numeral notation for that nerve, which is numbered numerically 1 to 12, and then the foramen, or the opening through which that cranial nerve goes, okay? At the base of the skull, and also the function of it. Most of the time, the name will tell you the function of that cranial nerve. And then lastly, I will need you to know what happens when you have a lesion or when there's when that cranial nerve is damaged. What happens? What are the consequences of that? And if you know the function of it, you will know the consequences of it when the cranial nerve is damaged, right? And in your LearnSmart modules, the biggest deal was actually matching the cranial nerve to the function. So that's what it's all about today. We're going to do that. Okay. But first of all, I need you to be able to tell me what they are. So there's a lot. There's 12 of them. With the Roman numeral notation, if you watch the Super Bowl, they like to use Roman numerals. I'm a big fan of the Super Bowl. Okay, so number V is 5, X is 10. So that's all you need right now because we're only going up to 12, right? So anything to the left of it, you are subtracting, okay? Anything to the right of it, you are adding, okay? So this would be 12, you see what I'm saying? So it's not that hard, you know what I'm saying? And if it's like that, 4, you see what I'm saying? So the other ones are 1, 2, 3, and that's it. Okay. There's a little mnemonic that you can use that will start with the letter of each of those words. Okay. On occasion, our trusty truck acts funny. Very good vehicle anyhow. Okay. So that means you got olfactory for smell, number 1. Optic for sense of vision, number 2. Okay, all right. And oculomotor, and it controls muscles of the eye, number 3. Okay, trochlea, another eye muscle, number 4. Trigeminal is a big fat nerve, number 5. Okay, and then the abducens is number 6. Okay, most of these are controlling eye muscles or something to do with the eye. And then the facial, number 7. And the vestibular cochlea, number 8, and then the glossopharyngeal, number 9, right? And number 10 is Vegas, it's in Las Vegas, right? So remember number 10, you know. And then the accessory, number 11, and finally the hypoglossal, number 12. So on occasion, our trusty truck acts funny. Very good vehicle anyhow. So those are the 12. Okay, so in each one we'll kind of let you know what the name of it. The name of it will let you know the function. Okay, for the most part. Okay, so these are them. And next year, next year in spring, the first lab we're going to do is the eye, the brain, and the heart. And then we'll dissect through the brain. We'll be able to identify all these in a sheep brain, which is about 3/4 the size of a human brain. Okay, so we'll be able to see that. So these are them. You can see these two here: optic number 2 and olfactory number 1, like that. They do not arise from the brainstem, and this is the brainstem. And all of them, you see what I'm saying, arise from the brainstem. And towards the end of the lecture, we're going to talk about brainstem reflexes, okay? Most of the time, not all of the time, but last time we talked about spinal reflexes, okay? Which use which use spinal nerves. Today we'll talk about brainstem reflexes, which use cranial nerves. See what I'm saying? Those ones are much more complicated, and I'll talk about it at the end. They are brainstem reflexes because they involve cranial nerves, of which 10 of them arise from the base of the cranium. So this is the trigeminal number 5. It's a big knot, and you'll be able to see it. The optic nerve forms a chiasma across, so that most of the sense from the left eye goes to the right side of the brain. Okay, so that's the optic chiasma right there. All right, and for the most part, so we will be able to identify this later on in ANP2. So cranial nerves, these are always mixed. Some of them are mostly sensory, or mostly motor. Okay, but almost all of them that contain that control muscles, like the muscles of the eye. Okay, we'll do eyesight next time, but right now, so you can appreciate the function of these cranial nerves, I'm just going to give you a quick do on the eyeball, because as you can imagine, the sense of vision is really very involving. Okay, so I'm going to draw my muscles green. Let's say this is the side of your eye. So this will be on 4 compass points of the eyeball. There's a muscle that controls your eyeball. Like when your kids roll their eyes at you, they're using these muscles, right? So and
so is that your oblique?
No, this will be my lateral rectus. My inferior oblique kind of goes here on the side. It kind of starts off from the lateral rectus and goes onto the side, and then here's my superior oblique. Will go like that. My superior rectus, you got me there. You put a bug in me that I couldn't get. And then the one that goes at an angle is the superior rectus. And then on the other side, which is the nose bridge side, there's another muscle like that. Okay? Inferior, lateral rectus, superior rectus, and then medial rectus on the medium, near the nose bridge. Right? And then we get an inferior oblique and superior oblique. Those 6 muscles. So we're going to talk about these cranial nerves, and we're going to talk. Some of them control most of them, like the oculomotor controls most of the ones on the compass points. This one, that one, and that one. Okay, and we'll talk about that. So it's sensory for the spatial senses and also the general senses, and then motor for the somatic, or facial muscles as well are also skeletal muscles. And then parasympathetic, which are the soft internal organs. Anything that's automatically controlled. It also gets motor control from the cranial nerves. And then, so we'll talk about the functions with that big table. We'll talk about the opening for that particular cranial nerve, and then what happens when there's a lesion, or when there's okay. So the first one is sensory. Okay. Because it's olfactory and it's smell, it's the sense of smell. It arises from the cerebrum, from the base of from the frontal lobe on the base. Okay, and this one, because the nerves for it are located on the top of the nasal cavity, on the superior part of the nasal cavity, there is a bone, the ethmoid bone, that has all these perforations that lets those nerves for the olfactory nerves go through. So that's the cribriform plate. It's a perforated hole, and you could see it when we. Some of you may have seen it when we were doing the scalp. Okay. So this is the cribriform plate. It will be the opening for it, and it's olfactory and it's cranial nerve number 1. Okay? Because sometimes I'll say, can you list 5 cranial nerves and tell me their function, tell me the opening through which it goes, and tell me what happens when there's a lesion. Okay? If you know the function, you definitely know what happens when something goes wrong with that cranial nerve, right? So that one will be a freebie point. Okay? So that's olfactory number 1. And then optic, ophthalmology, optician, deal with the eyes. So if you fail to say something about the eyes, then shame on you. Okay, the name will tell you what this, most of the time, what these cranial nerves are doing. So these are questions that you could Google up and get more points on. Optic nerve number 2, and it goes through what? Optic canal. Remember the optic foramen? Okay, I should have brought my skull in here so that we could I could be showing you the opening, and then that would have been good. I should do that. I always forget to do that. But I hooked you up with a picture at the end though that shows all these cranial nerves. Okay, so it's sensory for vision. Sensory for vision. So and then of course if something happens, you go blind, right? So this is very easy stuff. Okay. The oculomotor, number 3. So on occasion, our O. And except for number 1, it's got to do with the eyes. You'll find that most of these cranial nerves got to do something with the eyes. Okay. So number 3, remember that big crack behind the orbital called the superior orbital fissure that we did. A bunch of cranial nerves are going to go through that. Okay, especially the ones that control the muscles of the eye, because they're going into the eyeball, into the socket, into the orbit. So that big old crack up there. So that's the superior orbital fissure does that. Okay, so the oculomotor is one that controls, motor to those muscles of the eye. Like I was saying, the medial rectus, the superior rectus, and the inferior rectus. Okay, they're all controlled by that, in the inferior oblique. They're all controlled by the oculomotor. Oculo, eyes. Anything to do with oculo is eyes. Motor, controlling muscles. So that tells you. Okay? So those 3 muscles, if you say it controls most of the muscles of the eye, I'll take that. You don't have to tell me like medial, lateral, and inferior rectus, and also the inferior oblique. Okay? So whenever a cranial nerve controls muscles, there's always proprioception. Remember, proprioception measures the stretch of the muscles, so you can learn about the position of the body part. Okay? So if the medial rectus is contracted, it means it's pulling the eye towards the middle. So then your body knows your eyeball is facing that way. So whenever all these cranial nerves control muscles, there's going to be proprioception sense. Okay, proprioception. It's awareness of your body parts in space, right, where they are. So I can touch my nose with my eyes closed. You know what I'm saying? Because so that's what the proprioception sense is. Okay. Another thing is that the oculomotor also controls the superior palpebrae superioris, that muscle that controls the upper eyelid, opens and shuts the upper eyelid. Okay. So you can begin to see some things that may go wrong if something happens to the oculomotor. The oculomotor is another big fat one, so it's doing a lot of things. You see that? Apart from that, it constricts, the sphincter pupillae. They are muscles of the pupil that, so the pupil is like a hole through your eye that regulates the amount of light entering the eye. So you've got circular muscles that when they contract, they will constrict the eyeball. So the oculomotor controls those muscles. Okay? And that's parasympathetic because those are smooth muscles. Okay? Right? And it's automatically controlled. Like if I suddenly flash a light a light in your eye, it constricts. That's what they use actually when you pass out. The doctor wants to see how responsive you are. They shine a light on you, and if your pupils constrict like this, they say, "Oh, we can save this guy. He's still on." Okay? Yeah, you see what I'm saying? And it's oculomotor that controls that. It's a reflex actually. You don't think about it, so that's why it's parasympathetic. It's automatically controlled. Okay, so it controls those circular, and then there's other radial muscles that dilate the pupil. But this one controls the one that, the sphincter that constricts the eyeball. So if something happens wrong with it, of course, your control of the muscles, of the eye, your eyeball just sort of faces the wrong way, you know what I'm saying? And then you get double vision. Anything that controls the eye muscles, one of the lesions you have to say is that double vision, because your eyeballs will be facing the wrong way, number one. And then it also causes ptosis, ptosis, which is spelled PTO, which is like a droopy eyelid because it controls the upper eyelid muscle. So it's kind of like a lazy eye, when somebody's got a lazy eye that kind of just dangles the what do you call it, the eyelid. So that's ptosis. Okay, so you can say several things about what goes wrong with it. And because you know what the function of it is, you can tell me a little bit about it, okay? So we gotta spend some time on that because this is a very busy one, the oculomotor, okay? But it does a big job. And then after I talk about a few, I'll show you pictures of actual brain dissection, okay? Olfactory number 1 through the cribriform plate, okay? And then those are the olfactory bulbs and the olfactory tracts here. And then, you know, these are located in the nasal cavity. That's why when you smell something, you suck in some air through the nose. If you do it through the mouth, you won't smell it because the receptors for smell are in the nose, okay? There's the olfactory bulb, olfactory tract, okay? And then the optic nerve with the optic chiasma, the cross for the sense of vision, so it's sensory. Okay, and then you can see here, there's an MRI showing the optic nerve over there, okay, and so forth, through the optic canal. All right, very good. So you can look at this later on. You see how it's controlling those muscles I talked about, okay? The oculomotor controls a bunch of them, you know, medial, you know, so forth. Inferior and superior obliques, inferior oblique and superior rectus. Okay, very good. So we move on to the next. Number 4 is trochlea. It's a very small one. Number 4, trochlea only controls like superior oblique. Only one of those eye muscles. Okay, so optic is got to do sensory with eyes. Oculomotor is got to do with muscle control and also the eyelid, upper eyelid, and also the sphincter, the pupillary that constricts the eyeball. Trochlea, you know, so 3 of them so far, of the 4 we've talked about, got to do something with the eye. Okay, and that one also controls the superior oblique. Remember the one that was at an angle at the top of the eye muscles. Those are called the extrinsic eye muscles. Okay, so the trochlea goes again through the superior orbital fissure. Because remember, that's why it's a big old crack like this, so it can let a whole bunch of cranial nerves through. Okay, superior orbital fissure, and trochlea is got to do with the eyes. It controls the superior oblique. You know, so anytime you kind of control the eye muscles, you know, the eyeball kind of just faces the wrong way, and you get double vision. Because those eyeballs help to focus the eye on, you know, a particular object. So if those muscles are not controlling it, the eye is just kind of rolled over or whatever, then you get double vision. So that's an easy one too. So that's a small one. And then the trigeminal, did you see that? You got a question?
No.
Okay. Yeah. Yeah, it's got a lot of things. So now, the trigeminal is another big fat nerve with a whole bunch of functions, okay? In fact, it's got 3 branches, okay? It's got the oculomotor with the ophthalmic branch, which kind of controls sensory to the eye surface and the cornea and things like that. Then it's got the maxillary branch, which kind of controls the upper teeth, the upper jaw, the gums, okay? Okay, sensory from that. So sometimes if they're doing teeth work, they just go straight into that cranial nerve and numb that one, so that it kind of, the whole top is gone. You know, they can work on any of your teeth up there. You won't feel it. Sometimes they do that if they're working on the upper teeth instead of, but most of the time when they're working on the lower jaw, they may have to individually do that. Okay, but yeah, that's what it is. And then the mandibular branch also serves the lower jaw. It's the same cranial nerve here, trigeminal number 5, which is a V. Okay, and then you know, it controls that, and then because it's so big, it goes through 3 of these foramina. Okay, you see they get the superior orbital fissure again, then the foramen rotundum for the maxillary one, and then foramen ovale. Remember that oval-shaped foramen. The mandibular branch of this trigeminal goes through that. So it goes through 3 foramen. Okay, because it's just too big. And you will see when we dissect through the brain, you see how fat it is like this blessing. It will be fat like that. So again, the name will tell you what it is. Ophthalmic, of course, deals with the eyes. Okay, so it's sensory on the eyes and so forth, and the upper nose. Okay, and some of the skin of the face. Okay, you see how it's all shown up here. sensory to that. So that's the ophthalmic. You see how it's sensory to this and sensory to the eyes. Like if something gets into your eye, it's irritating your cornea. The ophthalmic branch of the trigeminal nerve is doing that. All right. Okay. And then the maxillary controls, you know, the nasal, the nasopharynx, you know, the behind the posterior nares, right at the top of your throat is the nasopharynx, because your nose opens, your nostrils open at the back there. Okay, it controls the upper jaw. Maxilla is the upper jaw. All right, and then the gums and the upper teeth. Okay, so that's all sensory and motor as well. To you know the muscles that control the lower jaw, the tongue. Okay, is controlled by the you know, mandibular branch, the lower one. So on top of that, because it's all up in the jaws, it controls things like the masseter muscle, for chewing. So the trigeminal is involved in chewing. Sometimes I have a multiple choice question and I say one of these cranial nerves is involved in chewing, and then I list a whole bunch of them with the trigeminal there. Etc. Okay? It's usually my favorite multiple choice question. So because it controls the muscles, you know, that control the jaw here, right there. Okay? So it controls the temporalis, you know, the pterygoides, all those, and the soft palate, anything in that throat area, you know, and the gums, and think that. That's where that cranial nerve is located, okay? So it's got 3 branches, and then it's got those 3 openings. And then, of course, you know, your tongue, you know, may just lose control, you know, it goes to one side. If you've lost it, you know, you lose the sensation in your eyes, in these areas that are controlled by that, okay? So that's trigeminal number 5. It's another big cranial nerve with 3 branches, all right? And it has 3 openings. So you can see the trochlea is just a small one. It controls the superior oblique, one of the extrinsic eye muscles. And then, of course, you get the trigeminal, which is very thick. It kind of sort of in the middle here, right there by the pons junction of the medulla oblongata. You'll see when we dissect it, cranial nerve number 5, and those are the branches. You see the ophthalmic branch that goes up to the top, controls the skin and the surface of the eyes and so forth. Maxillary, one goes through the foramen rotundum, controls the upper jaw, teeth, gums, you know, and like the uvula, the nasopharynx, at the back of the nose, the sensation in there, right? And then, of course, the lower jaw, and then the muscles of chewing. So mastication is the trigeminal nerve, okay? So when in the exam, I want you to mention the general functions of it. Like the trigeminal is involved in controlling muscles of the tongue, muscles for chewing, for mastication, okay, and sensory to the eyes, things like that. Okay, you know, so I want you to just give me the general function and then the general thing that happens when something goes wrong there. So abducens again controls the lateral rectus, okay, which is another extrinsic eye muscle. So far, except for the sense of smell, it's got to do with the eyes, whether controlling the muscles of the eye or sensing the eye and so forth and so forth. Okay, so trochlea number 6, V1, 6, again, goes through the superior orbital fissure. So a bunch of them go through there, okay, except for a few. Optic goes through the optic canal or optic foramen and so forth, okay? So it's motor, and then always when there's motor, there's going to be proprioception that sort of gauges the position of that body part that's controlled by that muscle. Okay, always. All right. Again, if it's controlling eye muscles, the eye will deviate to one side, and then you get double vision. So those are easy ones for all the eye muscle ones. Okay, goes through the superior orbital fissure. Then the facial, number 7. The facial is kind of funny because the facial actually goes through the internal acoustic meters, which means it passes through the ear. So if you have an ear infection, sometimes it may affect your taste, because guess what? The facial cranial nerve number 7, V211, okay, controls the anterior 2/3 of the tongue for taste, which is most of the tongue, okay? So if it goes through the, and if they're doing eye surgery and they happen to nick it, because if they're careless or they make a mistake, then you can lose taste most of your time, because that's what that thing does. And also, what does it do? Cranial nerve number 7, facial. It controls facial muscles for expression like smiling, frowning, and all that. Okay? It controls that. So those are the kind of general functions I want you to mention when you are talking about these cranial nerves. Okay? So facial is to do with the face, controls muscles for facial expression. Okay? It also controls the tongue, sensory, the upper, the anterior, the front 2/3 of your tongue. All that taste, those taste buds are controlled by that. Okay? And then motor to the muscles of the eye, muscles of the face for facial expression, and then of course proprioception of those muscles. Always when a cranial nerve controls muscles, there's always proprioception that judges. And then it also controls the submandibular and the sublingual salivary glands. There's one under here, okay, and one under your tongue, salivary glands. So your mouth becomes dry if there's something happens with this, something happens to this cranial nerve, number 7, facial. Also, because it controls facial muscles, you get what's called facial palsy, you know, where your face is kind of droopy like that, because your eye muscles have a certain tone in them to keep your face kind of right. So, but if the muscles are lacking tone, then you just, that's that.
So, like in Bell's palsy?
Yeah, that's what Bell's palsy is. Facial palsy is like Bell's palsy, when you got kind of like a droopy side, because those muscles. Yeah. Yeah, if you have a stroke too, and you know that side, whatever is, it just sort of ceases to function. Okay, and that happens too. So you see them sometimes they just droop on one side, and so if it's the right side, then in your left side of the brain had a stroke.
Right.
Because it's the opposite side of the body that's controlled. You see what? That's why all the cranial nerves always cross like that. Okay? Like the optic chiasma does that. You see what I'm saying? So this one is easy. Facial to do with the face, so facial expression, smiling, frowning, and all that stuff. All those muscles are controlled by that. And also controls taste on the tongue. So those are the big two that I would want you to mention when you talk about the facial. Okay? What does it go through? The internal acoustic meters. And then the stellomastoid, which we didn't know about. But the internal acoustic meters will do for me, and that's the one that, the ear, it passes through the ear, right in there. Okay? So that is called the chordae tympani, because it passes right next to those, tympanic membrane, the eardrum and so forth. Okay, the facial nerve goes through that. Just not too much space happening here. Okay, so that one is another not so hard one. Okay, let me see here. We may have something to do with the. I think we kind of lost the eyes now. All right, but for the most part, you see, we were talking about eyes. So now, when we go further from number 7, we're now talking the pharynx, the throat area, and the tongue. Okay? That's where most of the cranial nerves remaining are doing that. All right? Abducens, it's also, that controls eye muscle, the lateral rectus. Okay? And that's small. And then facial, of course, this is the branch that kind of controls facial muscles and so forth. All right? And then it controls the tongue. Sensory, the front 2/3 of the tongue. Okay, so this one is a big nerve, facial, so it divides it into the motor component, facial muscles goes to your face, all of this. Okay, and then of course controls the parasympathetic component, because the tongue muscle. Okay, that's just automatic, sensory, and so forth, and then the special sensory component there. All right. So this one is another sort of big one, doing quite a bit. All right. Then vestibulocochlear, the name says it. The vestibule is the part of the ear that deals with balance. The cochlea is the part of the ear that deals with hearing. So you know the function of this nerve. You see what I'm saying? Vestibulocochlear number 8, V111, Roman numeral notation. Okay. So this controls the ear. We've done a bunch with the eye now. We kind of move to the ear, and then we're moving to the throat area and the tongue and so forth. Okay? So vestibular cochlea, number 8, deals with sensory for the cochlear nerve and the vestibular nerve are two nerves that joined up together to form the vestibular cochlear nerve. All right? So it's got to do with hearing. So if the cochlear part of the deal is injured, then you lose hearing. If the vestibular part of it that is injured, then you get balance problems, vertigo or vertigo, things like that, vomiting, you do that, nausea, because you get nauseous, to do with balance. That's why sometimes when you were young, or maybe you do it now, you spin around, you get dizzy, then you fall down. You don't do it now, you guys are all old. But did you see how sometimes you get nauseous when that happens? When you spin, and you get dizzy, you get a little bit nauseous. I used to do that quite a bit.
How do people get seasick because of balance?
Because of the balance. I get seasick really bad. And I learned it the hard way. I didn't know, so I went on this boat and it was like this. My God, I couldn't do anything. I almost wanted to jump out of my skin. It was that bad. You see? So now I know. Won't do it again. And that was one that was acting up the vestibular cochlear nerve when I was having those problems. Okay? So, this one is another easy one because it's to do with the ear. It goes through the internal acoustic meters, right? It's only the facial that borrows the internal acoustic meters that doesn't have anything to do with the ear, but goes through the ear, right? So that's an easy one. Vestibular cochlear to do with the ear. It goes through the internal acoustic meters, right? So that makes sense because of that. So you get all those problems. Okay? Glossopharyngeal, even the name says it, pharynx. Remember I told you the throat area now is remaining, the tongue and the throat and all these remaining are kind of controlling the throat and the tongue and so forth. So remember we talked about the facial controlling the anterior 2/3. Now this one, for taste, this one controls the posterior 1/3 for taste. So if there's a lesion to it, you lose taste in just a little bit of your tongue, a 1/3, but you get the facial taking care of the anterior 2/3. So you probably will be able to taste most of the things. You know what I'm saying? Because it takes only a bit. So that anterior 1/3 will not be able to taste if there's a lesion in there. But it also controls the pharynx, the palatine, tonsils, posterior and 1/3 of the tongue and so forth for taste. Okay, and then motor to muscles of the throat area there, the sternopharyngeus, for swallowing and things like that. Parasympathetic to the salivary glands. The parotid is the one that wasn't controlled by the facial, because it only does the submandibular, sublingual. Then the parotid is like right here. It's a big one. Okay, so that's what, if you have difficulty swallowing, because it controls muscles of swallowing, right? Remember I told you it's got to do with the pharynx, the throat, now most of the time, and the tongue, all the remaining ones, and some of the viscera in here, which is, number, 10, which we're going to talk about in a little bit. But this one is mostly the tongue area, okay? Controls muscles of the throat for swallowing, okay? Goes through the jugular foramen because it's kind of coming down to kind of the throat. So the jugular foramen, the one that also carries the external jugular vein. So the jugular foramen, it borrows that. Okay, that's the glossopharyngeal. So sometimes you just have to think about where that cranial nerve is going, for you to kind of sort of think about which hole of the skull that it might go through. See what I'm saying? So this one goes through the jugular and it controls all that. So you have difficulty swallowing, your tongue, just 1/3 of it at the back. Want to have taste. Okay? So, and those are them. You can see the vestibular cochlea. The vestibular cochlea is kind of another thick one too, since it's the union of those two cranial nerve, really the vestibular nerve and the cochlear nerve. They just joined together to form that vestibular cochlea. So it's another thick one. So if you're lucky, sometimes we can see the vestibulocochlear, we can see the trigeminal, we will definitely see the optic and the olfactory bulb. But some of the other ones, like the trachea, they just get cut off. They get truncated. Okay. So that's number 8, vestibulocochlear. And then glossopharyngeal, number 9, so it's 1X. Okay. In the exam, I don't want you to say optic number 2. No. I want you to use the Roman numeral notation, okay? So, and that's not hard to learn, okay? So, anyway, vagus is one I was talking about. Number 10, it takes care most of the soft internal viscera in the abdomen. The liver, the small intestine, and so forth. And that's the parasympathetic, because all those are automatically controlled. Okay, so that's what the vagus does most of the time. It controls those soft internal viscera of the abdomen. Everything, kidneys, whatnot, all the stomach. Okay, so that's the big function of it. Again, it goes through the jugular foramen because it's coming down. You see, it's borrowing the jugular foramen. So the openings are not that hard for the most part. Okay, if it's not superior orbital fissure, it's the optic canal and so forth. Okay, so that's not too hard. And then the jugular foramen for these last ones, glossopharyngeal, this one, vagus. Number 9 and 10. Okay, so it will also control, like I say, soft palate, the pharynx, the intrinsic laryngeal muscles, right there in the throat area. So it's got to do with voice production too, because you see what I'm saying? It's right in the voice box. You see what I'm saying? So again, difficulty swallowing because it controls those muscles in the throat area for swallowing. Okay, so everything's kind of centered here, but then it takes care of a bunch of the soft internal viscera in the abdomen. Okay, so it controls all that. So that's the parasympathetic to the thoracic viscera. So that's a big one, because all those soft internal organs are controlled by the vagus nerve. Number 10, cranial nerve number 10. So because it controls the throat muscles, you have difficulty swallowing, hoarseness, because it's got to do with the voice box. Okay, it controls the voice box, which is where sound is produced. And your uvula, which is what closes the back of your nose, the posterior nares, it's called, kind of deviates to one side because it's kind of controlled by that. And therefore, it's no longer going to be actually flapping and closing the nose. So that when you swallow, most of the time, what happens, if you are able to swallow because it controls some of the muscles for swallowing, things can go up your nose because that flap is no longer in place. Okay, things like that. See what I'm saying? So for the most part, we just start with smell, then we get a whole bunch of eyes, right? Then when we go to number 8, vestibulocochlear, then we do the ears, and then after that is the throat. You know what I'm saying? So you can kind of sort of come up with something, in the exam situation in terms of function. It's not that hard. See what I'm saying? Okay, very good. So that's the vagus number 10. And again, goes through the jugular foramen. And then accessory is this one borrows the foramen magnum. The foramen magnum, that's where the spinal cord goes through. The foramen magnum is borrowed here. So that cranial nerve comes out through there too. Okay? Because and this one is controlling these muscles that move the sternocleidomastoid muscle. See, when I do this, this is the sternocleidomastoid muscle. Okay? It also lifts my thing up, my thoracic cavity when I'm taking a very deep breath. It yanks my chest up and out. Okay? Because you see how it's controlled. This is the manubrium, this is the clavicle, and sternocleidomastoid. So I can turn the neck, and when I turn, you can see it jutting out. So this accessory controls that, the sternocleidomastoid and the trapezius muscles, these muscles. Okay? So difficult elevating the scapula, and rotating the neck because it controls those muscles in the neck area. Right? So it's accessory. Very good. Goes to foramen magnum, also goes through the jugular foramen. So again, most of these, remember how big the jugular foramen is? Do you remember that? How jagged and big it is? Yeah? So, yeah, and the foramen magnum is the biggest opening because that's where the spinal cord goes through. Okay? So accessory, again, it's real easy. Again, it's in the neck area. So throat area. Everything remaining, now it's neck area, throat area, tongue, pharynx. Okay? And then those are them. You see that? They go down. Like the vagus goes down to the soft internal organs. Okay? So it goes through the foramen magnum again. I mean the foramen, jugular foramen. Okay? And then, of course, it controls the soft internal. That's a big function of it. That's the parasympathetic part. Okay? Vagus number 10. And then, of course, accessory number 11. X1, accessory 11. Okay? And then that's what it does. Controls the muscles, sternocleidomastoid, trapezius, turning your neck, elevating your scapula. Because, see, when you're in the gym, you do this for your trapezius. These are the trapezius muscles. Okay? So, elevating the scapula. So, when you do the shoulder shrug, you're doing that. Okay? And then the very last one is hypoglossal. It goes through the hypoglossal canal. I know it wasn't one of the ones we did, but it's kind of down there by the base. Okay, so it goes through the hypoglossal canal. So that's like the optic that goes through the optic canal. So you know what I'm saying. So that's not so bad. So it's motor again. It controls the tongue has got intrinsic muscles which are in the tongue because the tongue is a muscle itself, right? So those are the intrinsic muscles of the tongue, and then there are muscles outside of the tongue that control it too. Okay, so those extrinsic tongue muscles. So this is what it's doing. It's controlling mostly the tongue, those muscles. That when you swallow, you push your tongue up against the hard palate with your mouth closed, food goes to the back. You ever try swallowing with your mouth open, you squeeze the food, it will just come out. Okay, so that's that. So the extrinsic and intrinsic tongue muscles, I really need to know the names of those muscles. You know what I'm saying? Just the tongue muscles is good enough for me. Okay, if you say external and internal, that's all good. And whenever anything controls a muscle, you gotta have proprioception senses for it, because then it tells you the position of that body part. Okay, so of course, if the tongue just goes to like that, because you know it's no longer being controlled. Okay, so that's a vision that happens. So those are the 12, and again, mostly eyes, smell at the beginning, and then you know tongue and throat area and neck the rest of the way. After you do the ears, that's number 8 in the vestibular cochlea. Okay, so that's not too bad. Again, there's the hypoglossal right there. Goes through the foramen magnum. You see how it's going with the spinal cord? Because the spinal cord goes through the foramen magnum, that big old hole on the base of the skull. Right? And then I hooked you up with this. This was in your lab when we did it. You can look at it. It all shows all the openings of the skull, and so you just pick the ones for cranial nerves. Okay, so some of these are the foramen ovale and rotundum for that oculomotor. Just take that maxillary branch, and some hypoglossal canal does that. So you can just kind of, if you wanted to look at this, you could do that just so you can see. And this is the thing. Next time I'll bring the skull, I hope, myself, if I don't forget. Those are the opening, the foramen magnum, foramen ovale, spinosum rotundum in them. Okay, this is the superior orbital fissure, that crack where most of the nerves controlling the eye muscles go through, the cranial nerves, right? Okay, very good. So now it all makes sense. You were learning about those little holes and you thought, oh my God, why do I need to know about all these holes? Well, that's why. You see, because there's a reason why they're there for these cranial nerves and a whole bunch of blood vessels and things like that. Okay, so like I was saying earlier on, we've done so far spinal nerves and spinal, and then the spinal reflexes. So those ones arise from the spinal nerves. These ones now, these are brainstem reflexes, very complex. Okay, their networks won't even go into it because you know they're beyond the scope of the class. So, but they're mediated through the brainstem. Like I say, the brainstem, 10 of the cranial nerves arise from the brainstem, except just for the optic and the olfactory, which are sensory anyway, right? So these reflexes control complex movements, right? So remember when we were talking about the brain parts, what did I say about the brainstem? What was the big thing I said about the brainstem? We did it recently, right? What did I say about the brainstem? versus like the cerebrum.
You're done.
Yeah, you're done for because it controls a whole bunch of important stuff. Okay? So, reflexes at all levels in the brainstem, if they are non-functional, the brainstem is considered non-functional. And you know, that could be fatal because the brainstem has a whole bunch of important functions. There's no spontaneous breathing, okay? You know, because it's mediated by the medulla oblongata, right? Okay, so here I want you to know brainstem reflexes, okay? Brainstem reflexes are right, they use cranial nerves, okay? And their circuitry is so complicated, we won't even bother going there. But brainstem, in the exam, I want you to give me examples of brainstem reflexes. Don't pick up yet, guys. I got more for you. Okay. So when your eyesight, you know, whenever there is a certain movement, okay, a flash of light or a touch, you always reflexly look at that, okay, object. So you know, turning eyes towards, you know, one flash of light is an example of a brainstem reflex. Sound, like if I come and I clap on your right side, you look there. Okay. Touch, turning your eyes towards a touch. Remember what you do to your friends most of the time? What do you do to your friends? You touch them on the left and you go to the right. The reflex action is to look to the way you've been touched and your friend is over there. They think it's a ghost. You know, you'll be manipulating brainstem reflexes when you do that. Okay? Because the reflex is to look where you've been touched. But that's what you do. So next time you do that to your friend, know that you and you tell them about it too. Okay, because I will ask in the exam, can you give me examples of brainstem reflexes? Okay. So and all this happens reflexively. You don't have to think about it. As soon as somebody touches you, as soon as you hear sound, you face there. It's like a survival instinct kind of thing, where you hear sudden noise, you turn your eyes to see what's going on, so in case you need to be getting out of it. See what I'm saying? So those reflexes are important for us. They help us to survive. Okay? So another big one, okay, for gun enthusiasts, whenever you're following a moving target with your eyes, that's a very complex brainstem reflex. If you notice guys who, when they're doing shooting, they have a thing that throws a disc and then somebody shoots it. My God, that's like excellent brainstem reflex. To shoot a moving object, that's good. That's excellent. And that is, you know, so following, moving object, and my shortcut for with eyes. That's a very complex brainstem reflex. So if I ask you to give me examples, maybe 2 or 3, you can give me at least quite a bit. And you can have fun with it because brainstem reflexes control all those things that we like to manipulate. Sometimes you come and clap hard on your friend, like, you know what I'm saying? So those are brainstem reflexes. So thank you guys, I appreciate it. We will be going to the lab. I can meet you at, what time do you want to meet? We finish nice and early. Do you want to meet at 10 or you want to meet at 10:15? No, we can meet at 10 if you like, I don't mind.
You're not going to put the quiz up till Tuesday, right?
The quiz, you know, right now I'm working on some other things, and some other guys kind of wanted me to work on the review as well. You know, the review lecture, because we're going to do they wanted me to kind of give it to you before Thanksgiving so that, you know, you could be, because we're doing the review after Thanksgiving, right?
Right. Yeah.
So some people in the other class kind of requested that to get, so I'll work on that. And I can try to post the quiz, but you need to kind of study a little bit. The quiz is kind of easy. I just select questions and then I post it. 30 questions and then, you know, as usual. Yeah, I can post that. But I'm going to try and work right now on the review lecture so that I can also post that if I can. And it's so busy, it's unbelievable. Okay, guys, thank you so much. So please complete those course evaluation forms and let me know because we do appreciate that feedback. Okay, guys? Thank you.